Hey guys, so the purpose of this video is to bring together some of the content that you may have been studying for endocrine and do some practice questions. So like the first purpose of a course is to look at some scenarios and things that can come up with patients that have endocrine disorders. But the second purpose is also to go back in and start looking at some test taking strategies, start looking at kind of how do we break down these questions? Because while many students maybe just don't study enough and stuff like that. I would say some students don't study enough and things like that. Majority of problems that student and nursing students have with test taking has to do around their test taking strategies, the way they're reading questions or approaching questions. So hopefully there'll be something in here helpful for you one way or another. Let's look at the first question. It says, a nurse is caring for a client with Cushing's syndrome. Which finding is most indicative of the syndrome? So, with a question like this, first, I'm always going to recommend read the question and really try to figure out what it's asking you. So, first, I have to know what Cushing's syndrome is. It's telling me that I'm taking care of a client with it. And then it's saying which finding is most indicative of the syndrome. So, this is saying that when it says most indicative, it means all of these could possibly or potentially be a symptom. But which one, if I saw the symptom just by itself, would be enough for me to say that's probably Cushing's? Now, it might not really apply here because we'll have to kind of see how this all works out. But sometimes that's what it's really saying. It's going to give you a lot of answer choices that have similar disorders that you're going to have to kind of differentiate. Like, okay, well, like this is going to like, in other words, the other answer choices are probably very indicative symptoms of other endocrine disorders. So in other words, we're pretty much the professors, when we're writing a question like this, we're trying to get you to break down if you can kind of figure out like which endocrine disorder does this apply to. And so we're going to look for what's most indicative or which one we're going to expect to see. But really at the end of the day, this is really just comes down, do you know what Cushing syndrome looks like? And from the looks of it, it looks like a lot of these are diagnostics and things like that. So let's look at it. It says blood glucose 210. So that's a high blood glucose. So I have to know, hey, in Cushing's, do they have problems with high blood glucose? And I think they do, but I'm going to keep going because again, the question says most indicative. Even if it just said, hey, which finding is associated with this syndrome, I would still read all the answers because it's great, especially when you're doing practice questions, to be able to go through each one and really be able to tell yourself, hey, I am for sure that this is the right answer because I know the other ones can't be correct. Because sometimes I can convince myself of an answer, and if I would have read the other ones, I would have realized, oh, wait, I didn't read the question right. And I know sometimes when you're in the actual test, you're rushing, but if you practice this when you have the time, it's super helpful. So anyway, blood pressure, 210 over 110. Now, they might, with Cushing's, I know they hold on to fluids. Their blood pressure might be elevated, but that seems super high. That seems more like the pheochromocytoma, that like adrenal medulla, adrenal medulla tumor. So that doesn't sound exactly like Cushing's. Like I wouldn't think, oh my God, 210 blood pressure Cushing's. I would think, hey, high blood glucose Cushing's, but let's see. Sodium 125. So I know that with Cushing's that they have a sodium problem, but I'm not sure which way it is. So let me think about this. First, I have to know, is the sodium high, low, or normal? And this sodium is low. The normal is 135 to 145. So if I'm looking at this now and I know it's low, then I have to think about Cushing syndrome, what it looks like. So Cushing syndrome, they have too much of all of their, steroid hormones, and that can include aldosterone. Now, if I have too much aldosterone, that means I'm holding on to sodium and letting go of potassium. So I'm thinking that this can't be correct. This is probably that sodium like that. That's probably Addison's disease, which is the opposite of Cushing. So this is something else professors love to do is they like to put one in that's similar or the opposite of what's correct, but not exactly correct. So I'm going to go on. Body mass index 23. So then I have to know what's a normal BMI for a patient with Cushing's? Are they usually going to be smaller or larger? And a patient with Cushing's tends to have a larger body habitus or larger body mass and some of that steroid effect. So a body mass index less than 25 is normal. So I'm going to say this can't be correct. Or it's not to say that every patient with Cushing's is huge, but this is not something I'm going to be like, oh yeah, a low body mass index Cushing's. I am going to think, hey, low body mass index Addison's, but not for Cushing. So the best answer here is going to be A, blood glucose 210, because they have the elevated blood glucose because of those glucocorticoid effects. All right. Question number 2. Oh, and it's a select all that apply. A nurse is preparing discharge education for a client with hypothyroidism. So that means low thyroid function. And it's saying discharge education, which means I'm not in an emergency. I am just kind of helping this patient to get home, and I want to make sure they do not come back or have complications. It says which teaching points, more than one, should be included for this client. So it's really important when you're reading a question like this, when it's talking about teaching, you want to differentiate whether it's asking you, is this just a teaching point in general? Like which is what this question is. It's just saying which teaching points should be included. Could also say which teaching points are priority, or what is the most important things to teach this patient. So this is just asking true or false. Is this applicable to hypothyroidism? So we're going to start at the top and make our way down with select all that apply. We don't want to play games. We want to start at the top. True, false. Is it right or is it wrong? No, I have to have at least this many or not this many. Just going straight down. So let's first start with the first one. Avoid sedative medications as these may worsen your symptoms. So I have to think about hypothyroidism then and think about what's the problem here. And the problem in hypothyroidism, everything is low and slow. I'm thinking if things are low and slow, I don't want them taking other stuff that makes things low and slow. So avoiding sedative medications, that sounds probably pretty good. So I'm going to go yes. Says increase the amount of fiber intake within your diet. Well, this seems kind of like an off wall thing to ask, because it seems like, man, you got hypothyroidism, you got a lot of bigger problems than your fiber intake. But if I just said everything's low and slow, I wonder if that includes their gastric motility. And spoiler alert, it does. So they do have constipation really commonly with hypothyroidism. So increasing the amount of fiber in their diet, that sounds like a good thing. So I'm going to go with yes. The next one, you will need to take levothyroxine, which, if I know what my meds are, that is a thyroid hormone replacement for at least 1 year. Well, that doesn't quite sound right, because for at least 1 year sounds like at some point they're going to stop it. So then I have to ask myself, is this a med temporary? Is hypothyroidism temporary? And if I do know about that hypothyroidism, it's actually something they're going to need for the rest of their life. So this is not correct. And so it's really important when you're studying meds and when you're looking at these answer choices, you're looking at the time frame. Because if you just read the beginning, you will need to take levothyroxine. Yep, check, move on to the next one. Then you would get this one wrong. Because remember, the whole answer has to be correct. And D says you need to ensure you clean skin thoroughly with soap. Well, I mean, that sounds generally good. Keeping your skin clean, sounds great to me, but I really have to make sure for this patient it's appropriate. So this is a common issue that some students will have on these questions is they'll look at them and they'll say, cleaning your skin thoroughly, that's good for anybody. Like, let me check it, but you have to make sure that it's what's helpful for this patient. And when it says clean your skin thoroughly with soap, the other thing I remember is that a patient with hypothyroidism can have really dry skin that can break really easily. And I think if I remember correctly, in a table in the book, it talks about how we want to avoid soap and focus on lotions, like minimal soap, really like mild soap. Like we do not want to do a whole lot of soap. And it's not that they're going to need to get clean, but they're going to be so at risk for that dry skin that's going to get really damaged and cracked that I do not want to be doing this thorough skin cleaning because that's going to maybe make their condition even worse. So I'm going to say no for that one. And the last one says, keep your thermostat on a cooler temperature for comfort. So then I have to remember, okay, do they stay cold or do they stay hot? And with hypo and hyperthyroidism, one stays hot and one stays cold. So for hypothyroidism, I just have to remember which one is it? Like, do they stay more cold or stay more hot? And so with hyperthyroidism, they have trouble, with heat intolerance, where they do not handle temperatures well. Whereas with hypothyroidism, they don't stand cold temperatures well. Like they don't have a good tolerance for cold. So this E is appropriate for hyperthyroidism, but not for hypo. And this is something we'll do often and select all that apply, especially everything in endocrine, there's opposites. So you always want to look and make sure, because maybe you read something, you're like, oh, that sounds good, but is it right for this disease process? And sometimes those answers are right for the opposite one, but not for this one. So the correct answers here are only A and B. The rest are not things that need to be included. Question three. A nurse is caring for a client who's recovering from a parathyroidectomy. So, in other words, they had their parathyroid removed. The client begins to have muscle spasms and hoarseness in their voice, which the priority action. Apparently, I cannot have good grammar. I see, I can't even say that sentence. I do not have good grammar. So, I think it's because I rewrote, like, I was like, when I was writing this question, I was like thinking, oh, how should I write this? So I should say, what is the priority action for this client? So sorry for the mishap there. And so A says, draw blood for electrolyte. Oh, I was like, let me back up because I always say this is the common mistake that students make because they jump right into the answer choices. Let's see. So patient's recovering. Now, if it said, like a lot of times it's going to say like how immediate or how recent their surgery is. If it doesn't, I need to assume it's been fairly recently. But you always want to look at the time, like, okay, was it something like they're just out of the operating room or is it 3 days later? So anytime there is a time in there, you always want to note it, but it doesn't tell me here. But now it's saying they've started to have muscle spasms and hoarseness in their voice. Anytime I hear hoarseness, I'm thinking an airway issue. I don't like that. They're having muscle spasms. So I have to first figure out in my head, like, is this something expected for them or am I going to need to take action? And so, these answer choices are probably going to give me choices to either like call the physician or to take action or to assess something. Those are usually some of the ones that are, when we talk about priority actions, a lot of times that's what we're getting down to. So I really first have to decide, is this normal or not? And anytime I'm hearing hoarseness in the voice, that sounds like a laryngospasm. That doesn't sound good. So for me in my head, I'm already kind of saying like, okay, I probably need to take some action because this sounds very unsafe. But let's see what my choices are. It says draw blood for electrolytes and kidney function. Well, I probably want to know their electrolytes because I know that their calcium can be off after a parathyroidectomy, but I don't know that if they're having hoarseness in their voice, that's what I want to do because that's going to delay helping with the hoarseness in their voice. Have client do coughing and deep breathing exercises. Well, I mean, that sounds something that's good for people that are having respiratory issues, but having hoarseness in their voice, I don't see how coughing and deep breathing is going to help if their airway is spasming or closing. So while, like, a lot of times this sounds like it's related, it's not necessarily going to help. It's the same like even let's say like applying oxygen. It might seem like, oh man, yeah, I want to apply some oxygen. Their airway's closing, but oxygen can't get in if their airway is closing. So I mean, while these things sound like great things, I need to deal with the actual problem at hand, which is that they have hoarseness in their voice because they're having spasms in their airway that's starting to close, which can happen after this procedure, by the way. Administer calcium gluconate IV per order. So, I mean, I like that. Even if I did not know what the problem was, but I like it because it's action and it seems like there's something serious going on. So it seems like I might need to take some action. So let's say I didn't know that after a parathyroidectomy, they can have low calcium, which can lead to tetany, which can lead to complete closure of their airway. Let's say I didn't know that. Then this is already the best answer so far that I've seen just because it's actual action right now. And then my other choice is to administer antispasmodic medication per order. So I have two meds here. So I have to say, like, okay, well, what's going to have, if I'm down to C and D, which of these meds is going to have the most direct effect? So they're having spasms. So it seems like maybe giving an antispasmodic might help. But why are they having spasms? And patient with a parathyroidectomy is having spasms because their calcium is low. So I can give them the antispasmodic. It might decrease their spasms, but it's not going to change the fact that they're in tetany because their calcium's low. So the most direct or most helpful thing right now is going to be to administer that calcium gluconate in order to help to replace what's missing and get them back to where what do you call it? They're not in tetany and their airway's not closing, which is the goal. So C is the correct answer here. All right, question 4. A nurse is reviewing laboratory values for a client with diabetes insipidus. Which of these findings is consistent with this diagnosis? So this is a straight up knowledge question. So I'm looking at lab values, diabetes insipidus, and it's saying what's consistent with this diagnosis. And so this is like a true or false. It's either right or it's wrong. And you can see the format of these answer choices too, is that pretty much like they're taking two lab results, the urine specific gravity and the serum sodium sodium, and they're just like giving you every possible combination of them, and which one of these is correct. So this can confuse students, because a lot of times they choose the wrong answer, not because they don't know, but because they read it wrong. And this is one of the hard things when you're doing questions for DI or for SIADH. You always have to look at, are we talking about what's going on in the blood or what's going on in the urine? So with diabetes insipidus, I always think diabetics, they pee a lot. So this patient, they're going to have a lot of urine. They're going to be peeing, 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 peeing. And so because they're peeing, 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 does that mean that their urine is concentrated or diluted? So this is kind of how I approach these questions. Okay, so if I'm peeing a whole lot, they're going to have very diluted urine because there's a lot of water, not a lot of particles. So I know I can narrow that down to say that they have a low urine specific gravity, because a urine specific gravity tells me how concentrated something is. So with diabetes insipidus, they're peeing out a whole bunch of stuff. So they're going to have a low specific gravity or a low level of concentration. So I'm down to A and C. But then I have to figure out what's going on with their sodium. So then I have to think about, okay, if I'm peeing out all my fluid, what's going on in my blood? If I'm peeing out all my fluid, then in my blood, everything's going to be dehydrated because I'm losing all my fluid. So everything in my blood is going to be high, my urine is going to be low. So C is the correct answer here. Now, I know a lot of that, maybe if you didn't know about diabetes insipidus, that's not going to necessarily help you. This is not test taking strategy, but this is strategy for this disease process for you to help to start to think about, how can I approach this? Because this can be kind of tricky, thinking about what is going on where. And just make sure that you're always reading specifically what it's talking about, if it's talking about urine osmolality or if it's talking about serum osmolality. So question 5. Nurse is caring for a client with exophthalmos, fun word to say, by the way, as a symptom of their Graves' disease. Which nursing intervention will be most helpful for this client? So I have to know what exophthalmos is, which is where the eyeballs are like bugging out. It's kind of how you guys look by the end of the semester, especially during this last exam. You all look like you got a little exophthalmos. Then it's saying that it's related to Graves' disease, and that might be pertinent. Sometimes you do want to pay attention sometimes to the disease processes, and they're saying because it might be specific to this disease process. So, because for example, there might be a question that says, "Hey, a nurse is caring for a client with this symptom, with this disease," and the right answer might be related to that symptom, or it might be related to that disease. Now, 9 times out of 10, it's going to be related to that symptom, but you always need to pay attention because sometimes it's going to be more general teaching versus specific to that symptom. So it's saying which nursing intervention will be most helpful. So this means, again, all these answers could be correct, but which one is going to have the most direct or biggest effect for this patient? So starting at the top, it says rinse eyes with cool tap water 3 times per day. Well, I mean, that sounds all right. But what do you call it? I don't know about rinsing with cool tap water. I don't really see necessarily how that's going to help. I know we want to keep them lubricated, but I don't think we lubricate them with cool tap water. And doing it 3 times a day doesn't sound maybe as frequent as I might need. So I'm going to put that one on the back burner, but I don't think that's right. It says hold eyes shut at least once every hour. Well, maybe. It sounds like maybe someone would do, but I don't really like it. Like, I don't really think like shutting their eyes at least once every hour is going to necessarily help. It seems like there's something that could be more effective. Encourage client to sit upright as often as possible. Well, I know that part of it's a fluid thing, and I know that an upright position is really helpful to them. It helps decrease some of the swelling, which can relieve their symptoms. So I'm gonna say that's definitely more helpful than B, and I think it's safer than A for sure. And more effective as a whole. So far C is my front runner. Then D says rotate your neck instead of your eyes to look around. So that would be like looking like this, so you don't have to move your eyes. But I don't think you want them to keep their eyes still. I think you want them to move their eyes, or like, work on the muscles in their eyes so that they don't, that they have less problems. So, I mean, A, B, and D, I mean, it just doesn't like it. Those don't really, as a whole, they're not as direct or most helpful, and they're not going to have the best results. Like, if I really think about which one of these is actually going to help to fix the problem, like rinsing with cool tap water, it's not often enough and it's not the right stuff. It's not going to lubricate it, it's just going to wet it. Holding the eyes shut every hour, a little bit, but it's not going to really, it's not necessarily going to help. It's not going to create extra lubrication. Again, they can still have the same problem. It doesn't really get to the bottom of the problem. Rotating my neck instead of my eyes is kind of like avoiding the problem and not really addressing it at all. So, but sitting upright is the only option where I'm actually going to be getting to the bottom of the problem, which is that that it helps to decrease some of that edema associated with the exophthalmos. So C is correct. Question 6. Nurse is reviewing laboratory findings for a client. Based on the results below, what other priority assessment findings should be made? Priority assessments should be made for this client. So it says that we found that their urine is positive for catecholamine metabolite. Say that 5 times fast. So I'm reviewing lab results and it's saying, hey, you have to interpret what this lab is saying and then figure out, okay, what assessment, like, what do I need to do? Pretty much it's asking, what do I need to do next? Like, what can I do next? So it's pretty much telling me it's trying to help me to identify what disease process is this, and then therefore, what do I need to assess? So this is a two-part question in the sense that you have to figure out what is the disease and then what are you going to do about it, or how are you going to assess for it. And so this definitely is a complex level question that you guys love when we give to you, where you have to think really hard. So first off, I have to figure out what this is. Now, if I did have some knowledge, I would know that this is pheochromocytoma. So that has to do, it's an adrenal mass issue where they have too many catecholamines. So then I have to figure out, okay, if I know what that is, then which assessment is priority for this client? So it's not saying, hey, I'm going to do all these assessments probably, but which one is going to give me the most helpful information, or which one do I need to do right now? So assess the neurological system for decreased level of consciousness. So if I know anything about this adrenal tumor, I would know that they can it's like the fight or flight is activated. So if my fight or flight is activated, I'm generally not having a decreased level of consciousness. So I don't think that part's true. But I mean, a neuro assessment's usually priority, but I don't know if it's priority in this one. So I'm going to put that one on the back burner, but I don't like that one too much. Assess urinary system for decreased urine output. Now, we said that we did a laboratory test for urine being positive for something. So a lot of students may choose this answer because they're like, oh, like there's something going on in the urine. But we're just figuring out through the urine that there's too much catecholamines. We're not necessarily, there's no problem here with the urine necessarily. Now, do I need to check their urine output? Probably. But is it the most helpful or most direct thing? Do I sit there and think, ooh, pheochromocytoma, what's their urine output? No, I absolutely do not. So it's not going to be the most directly related. It says assess respiratory system for increased work or breathing. Now, this one, a lot of students would want to choose this one too, because airway, breathe and circulation, so it seems like, oh, I need to check that right away. If my fight or flight is activated, generally my airway is more open where I can breathe because it's like a bear's chasing me. So I'm go, 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 go. I'm not saying that they couldn't have breathing problems, but it's not my first go-to, oh my goodness, I need to like assess this right away. I need to check to see how they're breathing. So then last but not least, which hopefully is my right answer because I'm out of choices, assess cardiovascular system, my favorite, for hypertension and tachycardia. So for this one, this is going to be the most appropriate because if you remember with pheochromocytoma is they have that massive hypertension, like those 200 blood pressures. They have that racing heart rate. They can have an irregular pulse and dysrhythmias and stuff like that because their fight or flight is activated. When your fight or flight is activated, everything gets vasoconstricted. Your heart starts racing because again, it thinks you're getting chased by a bear. So it's trying to get you prepared and it's trying to get everything pumping and getting perfused well. So the best answer here, the priority assessment, is going to be to check the blood pressure. So really this is asking what's common and or what's deadly associated with pheochromocytoma. And so D is the correct answer there. All right, last but not least, a nurse is obtaining a history from a client who is suspected of having acromegaly. Which question would be most helpful to ask this client? So when there's a question like this, there's two ways that we can look at it. We can effectively what it's trying to ask me is what is associated with this? How am I going to know a client has this? So it could either be statements from the client that, hey, the client's stating this, which one of these, if the client said it, sounds most like acromegaly, or it could be like this, which questions am I going to ask? How am I going to get the information I need to know that it's acromegaly? So pretty much it's trying to see what, if you know the questions to ask to see if a patient has acromegaly or not. So which of these is most commonly associated? So once again, since there's so many fun endocrine disorders, there's probably choices in here that are related to other endocrine disorders that aren't acromegaly. So I need to watch out closely and make sure that I'm not jumping in too quick, being like, oh, that's related to something I know, so I'm going to choose it. So A says, have you had difficulty closing your eyes completely? Well, that reminds me of a couple questions ago, exophthalmos, but was that acromegaly? Nope, that was Graves' disease. So I don't think that's related. Have you been feeling more thirsty lately? When I think about more thirsty, I think about a fluid imbalance. If I remember acromegaly correctly, it's not a fluid imbalance that's going on, and there's not a sodium imbalance either. So I don't think that that would be correct. It says, have you been confused or disoriented more often? So I have to think about, okay, what would cause someone to be confused or disoriented, like a head injury? And I know some endocrine disorders can be caused by head problems, but usually it's like a mass or something else. And if I remember, the most common cause in acromegaly is a tumor of the growth hormone. So I don't think that that affects their orientation or their mental status. But this would be like if you had no clue what acromegaly is, like what a lot of students would choose because it seems like, hey, it's a brain problem, so it'd have to be that. But then the last choice is have has there been an increase in your shoe size lately? Now this just seems like an off the wall thing. Like why in the world would I be asking them about their shoe size? But believe it or not, it is the correct answer. Because with acromegaly, they start to have an increase in size. They have it in their tongue, in their hands, in their feet. They grow in muscle mass, but it's very weak muscle. And so, like Andre the Giant is the example that most people think of. And so, the increase in their shoe size, as oddball of a question as is actually a great question to ask a client because it can be a strong sign that they're having that change. Because generally, most people do gradually. Of course, increase their shoe size, but it's usually not that dramatic. So, anyway, needless to say, D is the correct answer. And even let's say that you don't like that answer, if you look at the other ones, it can't be the other ones. You can narrow it down and get to this one. So, I hope that this was helpful. I know it's just 7 questions, but I hope you started to learn some strategies and some stuff to start doing better on your exams. Pull it together for the end of the semester and make it through. Just take things one step at a time and use these test taking strategies to approach these questions. And when you're doing practice, really take the time to break down those questions and try to learn more and grow. I'll see you guys next time.